Today, I am honored to have the amazing Dr. Rebecca Bockow with me for a conversation about interceptive orthodontic treatment.
I think we can reframe the definition of phase one. Phase one is not just upper brackets on the upper front four teeth. It's about what can we do to help guide skeletal growth and development. So much of the breakdown we see in adults is secondary to some sort of skeletal or dental issue. When you expand early, when you treat early, these kids that are then come back as teenagers and come back as adults for retainer checks were stable.
Adult patients with a narrower maxilla have a higher incidence of sleep-related breathing disorders and obstructive sleep apnea.
You have to look at the bone. And if if the bone is more narrow top to bottom, that requires treatment. Irrespective of the teeth. I do think that we have an opportunity. And we have an opportunity to identify some of these unhealthy patterns and try to help resolve them rather than not doing anything and waiting till they're 12 or 13. I think our orthodontic community is so hung up on this diagnosis of sleep apnea. And I think that is a piece of what we can do, but it's so much more. I think if we focus on health is tongue posture, health is lips together, health is breathing, health is chewing, speech, and all of these things we have the ability to help with in early children. Snoring leads to poor school performance.
Decreases in gray matter even goes, I think had some of his studies
decreases in gray matter and a learning deficit that they cannot catch up from. That is haunting. Even if you don't want to treat in your office, no problem. But refer to sleep medicine, refer to ENT, help them find resources. If we can positively impact the airway in an adult by bringing both jaws forward and making the upper jaw wider, why can't we help with the kids? Of course, we're not going to treat if there's no issue. Of course.
Thank you for saying that. Yes.
We see a 5, 6, 7, 8, 9, 10-year-old, and we think that they have a malocclusion or some deficit that is so extreme it can't wait, then it warrants treatment. But if it can wait, then wait. Probably 20 years ago, there were pockets of people that said, you're not a real orthodontist if you're moving teeth with plastic. How dare you? The AO says by age 7, but there's never been any studies that 7 is this magic number. That joy, that elation when you and the parents realize that the kid isn't snoring anymore, that they're sleeping through the night. I don't understand the people that don't believe that there's power in this.